Alright, so this is my video for Module 13. This is over special tests of the elbow. So first we're going to do the valgus and varus test for UCL and RCL sprains. So for the valgus test, you're supporting the patient's forearm and wrist. They're relaxed. Place a valgus force to the patient's elbow. If they have pain, it's positive for a UCL sprain. For the varus test, you're again supporting the patient's elbow and forearm and wrist, applying a varus force. Test for RCL sprains, and a positive is if they have pain. So for lateral epicondylitis, we're going to do the Cosen's test. So for Cosen's, you're standing next to the patient, supporting their arm and holding their hand. They're going to pronate and radial deviate against resistance. So pronate, radial deviate. And pain on the lateral, over the lateral epicondyle, and weakness is positive for lateral epicondylitis. And then the second one, we're going to do passive tennis elbow. So you're going to have the patient relax, standing next to them. You're going to passively pronate and flex their wrists. And you're looking for pain over the lateral epicondyle, and it's positive for lateral epicondylitis. For medial epicondylitis, we are going to do the golfer's elbow. So this is kind of like the passive tennis elbow, but we're going the opposite direction. So again, you're behind them, holding their hand. You're going to passively supinate and extend the patient's wrist. And pain over the medial epicondyle is a positive test for medial epicondylitis. So next is Tinel's sign. So you are supporting the patient's arm, they are relaxed, and you take your finger and you tap over the groove of the ulnar, or the area of Struthers, or the groove of the ulnar nerve. And if they have tingling in their arm due to the tapping, it's positive for ulnar nerve compromise. Now we're going to do the pinch grip. So your patient is seated, and you instruct them to attempt to place their thumb and their pointer fingers together. If they are unable to do that, it means they have loss of function of the anterior interosseous nerve, which is a positive test for that if they're unable to do it. And then finally, we're going to do the test for pronator teres syndrome. So for this test, you're going to support the patient's elbow. You've got them. They are going to pronate against resistance as you extend their elbow. So pronate. Pain over the pronator teres is positive test for pronator teres syndrome. If the patient does not have any symptoms and you still think that it is either pronator teres syndrome or carpal tunnel syndrome, if they have no symptoms with this test, then the test indicates that the patient may have carpal tunnel syndrome. All right, that's it for this video. Thanks.